चमक चमक तेरी पौजो ले बोलाया लाई दे पीरती तेसे ले माया.
Now I will demonstrate how to hold a curved metallic tongue depressor. There are two type of metallic. There are actually four type of tongue depressor: metallic, plastic, and wooden. And metallic tongue depressor is again of two type: straight tongue depressor and curved tongue depressor. What are the purpose of straight and being curved? Curved tongue depressor is used in the patient in sitting position, and straight tongue depressor is used in the patient in lying or lying position for proper visualization. Okay, now the holding procedure. Now you can easily see there is a wider part and is a narrower part. The narrower part should be or must be holding by your hand. Okay, and the wider part should be used to pressing the tongue, and it always before the junction of the anterior two-third and on posterior one-third of the tongue, so that gag reflex not stimulated. Okay, because posterior one-third of the tongue is supplied by glossopharyngeal nerve. If you press before after the junction of the anterior two-third and posterior one-third, it is foramen cecum. After the foramen cecum, then gag reflex will be start. So it must be before or anterior to the junction of the anterior two-third and posterior one-third of the tongue. Okay, so wider part in this manner. Okay, this part.